And welcome to the Best Docs Network in the studio. We are proud to have Dr. John Barnett, one of the top plastic surgeons in the entire Dallas-Fort Worth area, known for creating some of the most beautiful breasts in the world. What makes a beautiful breast?
Looking natural, feeling natural, and acting natural. By that I mean when the woman moves, they bounce.
All right, Dr. Barnett, you use saline implants and you put them on top of the muscle. Why do you do that?
The saline implants, you have an adjustability factor. Most women are asymmetric in the breast, so you can get them to where they look equal, almost exactly equal. You can't do that with a gel. You got to order different sizes, and they don't come in 10 cc increments. So it's very difficult to get the size right by eye. As good as I am at that, I can't just eyeball it exactly how many cc's difference. Okay, number one. Number two, that's how everybody was taught to do it on top of the muscle. It sounds like a logical idea, but it's a false assumption. It doesn't work. Here's why. Skin stretches. That's why you can take somebody who's really flat-chested and turn them into a 34, 36C. It looks great and natural. The skin stretches, but so is that muscle stretch. It starts out about like this, and then it ends up about like this. There's no going back from that, okay? It still retains some contractility. That's why when they flex their chest wall muscle, the implant will move around. Looks really nice, really natural, looks good. So when you put it under the muscle, it's an anatomically and physiologically abnormal thing. If a woman's breast is a little bit low set, you have what's called Snoopy's nose effect. Your breast sort of falls off the end. Here's the implant way up here, and the breast sort of falls off. That's why a lot of people get breast lifts in association with their augmentation, because the surgeon's trying to make the patient fit the operation rather than the operation fit the patient. You know, there are a lot of people who got a lot of scars on them that they didn't need.
Explain, Dr. Barnett, what a good-looking breast is.
A good-looking breast is supposed to have a gentle slope here. The fullness is down below, and the nipple is supposed to hit around about the middle of the upper arm. And they're not supposed to look like you got shot in the back with a cruise missile, which is the way a lot of them look. Yes. They're not supposed to be torpedo-like. They don't start way the hell up here. And, you know, they just have a natural, smooth shape.
If someone is coming in to get breast augmentation, you see different age groups. What range, and who's the perfect candidate for this?
I'm not sure there's a perfect candidate. Somebody who's flat-chested, that's a good candidate, you know. People have had children, which are a train wreck to a lot of people's body. You know, from 18 to 80. If they want it and can be done and need it, there's no reason not to do it.
When you get through with surgery with a lady who has breast augmentation and they come back, you've seen a number of them. What have been their response?
They're happy as, you know, a clam. They love it. It's the gift that keeps on giving, and it gives you more self-confidence, even if you didn't need any. You know, even if you're drop-dead knockout, it's going to boost your self-image and how you relate not only to your environment, but to yourself.
Dr. Barnett, your expertise comes with a lot of experience. How long have you been doing this?
37 years.
And you've done everything from breast augmentation to all sorts of plastic surgery.
Every kind of plastic surgery related to cosmetic surgery.
But plastic surgery, when it comes to that, breast augmentation is your favorite.
It's my favorite. Well, because it creates a thing of beauty. It makes women very happy. We do body sculpting, and eyelids and faces, and et cetera, but breasts are my favorite.
All right, Dr. Barnett, thank you for being with us in the studio. Appreciate it. We'll see you soon.
Pleasure to be here. Good.